Salvador. We are students from University of Santo Tomas taking nutrition and dietetics. We just like to ask some few questions that may help us to learn more about a certain disorder.
Encountered patients with the G6PD deficiency.
Can you share us po ba some knowledge and experience about that?
Usually they come, I had a few male patients with G6PD deficiency. Usually they come already with the symptoms of such as jaundice or fecal or urine. Once they have symptoms, that's the only time they come, because some would forget that they have G6PD, so they get to eat or take drugs that are prohibited.
Doctora, what is the importance of G6PD in our body?
Okay, G6PD or glucose 6-phosphate dehydrogenase is an important enzyme in the body. Usually, it is an enzyme that speeds up some chemical reactions in the body. So one major role of G6PD is the protection of the makeup of red blood cells in the body. So once it is deficient, red blood cells are easily destroyed. Once the body is exposed to food or infections or stress in the body. Okay.
What causes for the deficiency?
Okay, G6PD deficiency is an hereditary disease. It is X-linked. So it means, kasi medyo, this is a hyphenating word, no? X-linked means, kasi you have X-linked hereditary. So X-linked means it is passed through males now. So yes, usually males, because our chromosomes, about 23, we have 23 pairs of chromosomes. So the 23rd is the sex chromosome. So usually the one pair of usually it's the sex chromosome is composed of either XX or XY. So XX would be female, XY is male. Okay, so a pair of XX chromosome, one X came from the mother, and then the other X is from the father. And then if it's a male, the X came from the mother, kasi XX ang mother eh. And then the father is XY. So yung Y nung magiging male came from the father lang. So usually, it's X-linked, meaning the gene that causes the G6PD deficiency is only manifested in the X chromosome. Ibig sabihin, since the female has 2 X chromosome, kahit destructed, kahit sira yung X chromosome ng isa, meron pa siyang isang X. So meaning, it will not manifest in the female. It will only, sa male chromosome, XY. So once na destructed, sira yung X chromosome ng sa male, wala nang isa pang X na mag-make up for the loss ng isa, diba? So, usually, sa male lang siya. Kaya X-linked hereditary lang siya. Okay, disease.
Are there any specific age group ba?
Actually, no. Kasi once you have inherited it, you already have it. Diba? Kasi it's in the chromosome eh. The cause of the yes, inborn na siya. So, meaning, if you have it, you won't have the symptoms. Okay, only when you are exposed to the triggering factor, which is yung food, the bawal, medicines, or infection. Infection is kahit ano infection, viral infection, bacterial infection, it will cause stress sa body ng bata. So it will manifest, kasi any infection will affect the blood. So since hindi makakope up yung blood, kasi mahina yung red blood cell niya, dahil wala nga siyang G6PD, it easily gets destroyed. Okay, so affected. siguro when you were born, we already have the newborn screening. Sabihin ng newborn screening, now kasi it's a law, no? All babies, all Filipino babies should undergo the newborn screening. Newborn screening screens for 5 inborn diseases, okay? So, one of the inborn diseases is G6PD. So, it's only a screening. So, once it's sinabi nilang low, you have to go for confirmatory testing. So, it's done in UP. Ano? But, for example, the patient is old na and wasn't able to, example, the patient was born in a remote place. They weren't able to do the newborn screening. You can do the G6PD screen. So, most, syempre, hospitals, pero here in Manila na lang, would have it, no? So, it will detect an absent or low G6PD enzyme in the body.
So, blood exam lang.
Yes, blood exam yan. So, if that's only the screening if you have the G6PD. Pero once you have the symptoms, there are other different lab tests that you can do. Okay?
So, are there any situations that this condition might lead to a severe state?
Yes. If the, commonly kasi the symptoms of G6PD would be hemolysis. Ibig sabihin ng hemolysis, the destruction of the RBC or the red blood cells. Ibig sabihin, the patient will bleed. In some other, you won't see it, it will not cause those bleeding, but the urine can become T-colored. Ibig sabihin, the blood is passed through the urine. It's not red, but it may be T-colored. Pwedeng yellowish discoloration of skin or jaundice. Okay? It can be paleness. Kasi, you may destroy yung kanyang red blood cells. So, lab test, so ibig sabihin na magkakaroon siya ng hemolytic anemia. So, hemolyze, ibig sabihin na-break down lahat ng red blood cells niya. So, once you're exposed to the food, nakain niya yung food na bawal or yung medicines na bigay sa kanya, it will cause destruction ng RBC. So, ngayon, if it will cause severe hemolysis, the patient can die. Kidney failure, tapos eventually death.
So, as a doctor po, what are the recommended treatments for a patient with G6PD deficiency?
Okay. First of all, syempre prevention. So you should prevent the patient, syempre educate the person or the patient, the parents of the patient that G6PD patient siya, there are food and medications that cannot be given to that patient, to the child. Okay? So, dapat meron siyang list and eventually if every time they go to a doctor or they should inform that the patient is G6PD deficient. The doctor would be warned of the medications that to be prescribed to the patient. Siyempre yun, prevention or education. So, prevent yung ano. And then, secondly, if given that the patient already had the symptoms, okay, meron na siyang hemolysis, hemolytic anemia, siyempre first, what caused the anemia? What caused the hemolysis? Baka may infection siya. Siyempre, treat the infection which caused the hemolysis or the breakdown of the RBCs. Second, some would need transfusion because, syempre, nag-bleed na siya. So, pale na siya. Syempre, pag pale siya, yun nga, shortness of breath, eventually, cardiac na yung symptoms niya or pwede na siya namatay. So, transfusion agad, yun yan. If severe lang naman. Severe, oo. You can also give, actually, some would spontaneously recover because the body continuously produce red blood cells, new ones. So, it can replace the ano. But if the hemolysis is severe nga, mas mabilis yung bleeding, then the supply of the RBCs. So, eventually, better yung mag-transfuse. Yeah.
What is the recommended diet for a patient suffering with this deficiency?
Actually, wala nang, there's no really recommended diet. No? It's just that there are food that or should be avoided? Usually, ang cause daw, it's G6PD is some deficiency is also called favism, no? But favism because in the Middle Eastern descent, which commonly has the G6PD kasi mas common siya sa Middle East, no? May fava beans doon na available. It's in their diet talaga, in their, pero here, it's not available naman. So usually, here in the Philippines, it's more of infection, yung mga nag-trigger na factor. Infection, usually kasi yung mga medications kasi would be anti-malarial drugs, sulfa drugs, yung mga sulfamethoxazole, ganyan. And, NSAIDs, yung mga non-steroidal anti-inflammatory drugs, aspirin or mga Advil, yeah, yung
Thank you po, Dr. Salvador, for sharing us what lupus 6-phosphatase dehydrogenase deficiency is. Really appreciate for sharing your experience and knowledge with me.
Okay, thank you. All right.